Welcome to Citizen Portal, the federal edition, your go-to source for everything happening in federal politics. Let's dive in and keep you connected to what matters most on the national stage. Hey everyone, welcome back. Today we're diving into something pretty interesting, a government meeting on longevity and public health. We've got excerpts from the meeting transcript. Ready to see what we can learn?
Definitely.
Get this. There are places in the world where people routinely live like a decade longer than the average American. What's the secret? Let's find out.
I was really struck by the sense of urgency in this meeting. The stats on health in the U.S. are pretty alarming.
Yeah, that $4.9 trillion number for healthcare spending, it's a lot. And 85% of that is going towards managing chronic conditions, heart disease, diabetes, cancer, things that could be prevented in a lot of cases.
Exactly. And that's really the point here. It's not just about living longer. It's about living healthier and shifting from reactive healthcare to a preventative model.
So health span versus lifespan, they talked about that in the transcript. Living to 100 is great, but not if you're sick for the last 30 years.
Right. The focus should be on maximizing those healthy years. And the experts said we have more control over that than we might think.
Which is where the blue zones come in. This is where it gets really interesting. They spent a lot of time discussing Dan Buetten's research on those areas where people live way longer and healthier.
Yeah, the blue zones are fascinating. They show that lifestyle choices make a huge difference. Okinawa, Japan, Sardinia, Italy, Nicoya, Costa Rica, Icaria, Greece, and even Loma Linda, California. They all have different diets and exercise habits, but there are some key lifestyle factors that contribute to their longevity.
Okay, so no crazy diets or expensive treatments. What are they doing?
Well, they're not exactly gym rats. They incorporate a lot of low-intensity movement into their daily lives, like gardening, walking, chores. They average about 8,000 to 10,000 steps a day without even trying.
I might need to start taking the stairs more often. What about their diets? Is there a blue zone diet?
It's not about a specific diet. It's more of an overall approach to food. They eat mostly plant-based, lots of whole grains, legumes, fruits, and vegetables. They focus on fresh, local ingredients and cook most of their meals at home.
So it's about getting back to basics. Real food, ditching the processed stuff. Makes sense. But there's got to be more to it than just diet and exercise.
You're right. Social connection is huge. These communities are really close-knit. They have strong family ties, active social networks, and they often do things together as a community.
It's like the opposite of how we live now. We're always connected online, but increasingly disconnected in person.
Exactly. The blue zones remind us that social connection is essential, not a luxury. And the people in this meeting recognized that. There was a lot of talk about how to apply these lessons to the U.S.
Okay, so how do we translate that to our own lives and our communities? Is that even possible?
That's the million-dollar question. And the meeting tackled it head-on. A lot of people, including Dan Buettner, argued that we need to think bigger. It's not just about individual responsibility. It's about creating environments that support healthy choices.
So making the healthy choice the easy choice.
Exactly. Buettner had some great examples of policy changes that have really made a difference, like complete streets policies that prioritize pedestrians and cyclists.
So like redesigning streets to encourage walking and biking. I remember reading about that. Did they mention any places where that's worked?
They did. Albert Lea, Minnesota, they implemented a bunch of blue zone initiatives, including complete streets, and they saw a big increase in physical activity and a decrease in healthcare costs.
Wow. So it's not just about willpower, it's about creating an environment that nudges people towards healthier choices. But what about the cost of all this? Redesigning streets, promoting healthy food. That's got to be expensive.
It's a common concern, but the meeting actually highlighted the potential savings. By preventing chronic diseases, we could actually save money on healthcare in the long run.
Interesting. So it sounds like there are things we could do on a community level. But what about individuals? What could people start doing today to improve their health span?
That's a great question, and one that the meeting addressed. While systemic changes are crucial, individual actions still matter. Even small changes, if you do them consistently, can make a big difference over time.
So what are those small changes? What can our listeners start doing today? This is where I think things get really exciting.
One of the simplest things is moving more. And I don't mean intense workouts. The Blue Zone folks aren't hitting the gym. They're just moving throughout their day.
So ditch the all or nothing mindset. Just move more consistently. That can still feel hard, though. Any tips for making it easier? More fun, maybe?
Yeah, definitely. Think about what you enjoy. Maybe dancing, gardening, hiking with friends, even a walk around your neighborhood. Make movement part of your day, not a chore.
I like that. Find joy in movement. Speaking of joy, let's talk food. A plant-based diet sounds good, but how do we make it work in real life?
Right. Access to healthy food is a challenge, and that needs to be addressed at a policy level. They talked about expanding programs like SNAP to help people buy fresh produce.
Yeah, it's not just about individual choices, it's about making healthy choices available to everyone. But in the meantime, what can people do to eat more plant-based?
Start small. Add more fruits and veggies to your meals. Try some new plant-based recipes. Focus on placing processed food with whole, unprocessed ingredients.
It's about progress, not perfection.
Exactly.
What about social connections? We know they're important, but it can be hard to make time for them.
The meeting had some good strategies. Connect with loved ones regularly. Call them, video chat, visit in person, join a club or group, volunteer. Even small things, like smiling at a stranger, can make a difference.
Be intentional about those connections. Don't let them slip away. And it's not just about quantity, it's about quality too.
Exactly. It's about belonging, purpose, support. That brings us to another interesting point, the role of purpose in longevity. People in blue zones often have a strong sense of ikigai. It means reason for being.
Ikigai, I love that word. So how do you find your ikigai?
It's a bit of searching, and a bit of it finding you. Explore your passions. Think about what brings you joy. How can your skills contribute to something bigger than yourself? Be open to discovering what gives your life meaning.
So aligning your actions with your values, living a life that feels authentic. But what about genetics? Don't our genes play a role in how long we live?
They do, but the experts emphasize that lifestyle choices have a much bigger impact. Buettner's research says about 80% of our lifespan is determined by lifestyle. Only 20% is genetics.
Wow, so it's not all predetermined.
Not at all. A healthy lifestyle can really reduce your risk of disease.
It's empowering, knowing we have control over our health. But making these changes can be tough. Where do we start?
You're right, it can be overwhelming. The key is to start small. Build sustainable habits. Pick one or two things to focus on. Make gradual changes.
Baby steps, consistency, celebrate the small wins.
Exactly.
But what about when we slip up? No one's perfect.
That's where self-compassion comes in. Be kind to yourself. Setbacks happen. They're normal. They're opportunities to learn. Just get back on track.
Progress, not perfection. This reminds me of something else they discussed. Mindset, how we think about aging.
Yes. Our attitudes and beliefs about aging really matter. Cultures that view aging positively tend to have more longevity.
So instead of dreading getting older, we should embrace it.
Exactly. Aging doesn't have to be a decline. It can be a time of growth, learning, contribution. And that leads to another important point, lifelong learning.
I like that. So what does lifelong learning look like? Is it formal education or just staying curious?
It can be both, taking classes, reading, learning new skills, or just having interesting conversations and experiences. Keep your mind active.
Stay engaged. They also talk about purpose in later life.
Right. It's not just about living longer. It's about living a meaningful life.
So how do we maintain that purpose as we age?
That was a big question. And it seems like purpose can come from many things. Work, volunteering, hobbies, relationship.
Find what makes you feel alive, what gives you that sense of satisfaction.
Exactly. And that brings us to another important factor, community support. Having a supportive network makes a big difference as we age.
We need those connections. We need that sense of belonging. We're not meant to do life alone.
Right.
We've learned so much. It's really made me think.
Me too. I think one of the biggest takeaways for me is the importance of a holistic approach.
Right. It's not just about eating right and exercising.
It's about social connections, purpose, supportive environments.
It's all connected.
Exactly. And ultimately, it's about recognizing that we have more control than we think.
Yeah. We can make choices today that shape our health for years to come.
One of those choices that really stood out to me was the focus on strength training.
Oh, yeah. Dr. Caddick's testimony was fascinating.
She made such a strong case for it, especially as we age.
She said it's not about getting ripped or anything.
It's about functional strength, maintaining independence as we get older.
Right. I was surprised to learn that grip strength can be a better predictor of heart health than blood pressure.
It's a good reminder that we need to look at the whole picture.
Not just the traditional markers of health.
A strength training helps with bone density, preventing falls, mobility.
All so important as we age.
And it's never too late to start.
Exactly. There are so many ways to do it. Gyms, trainers, even videos at home.
Find something you enjoy and make it a habit.
Speaking of habits, we also talked about social connections.
Yeah, those bonds that support us through life.
And Buettner's research shows that they're directly linked to longevity.
People in blue zones, they prioritize face-to-face interaction, communal activities, a sense of belonging.
It's so different from how we often live, connected online, but disconnected in person.
We need to be intentional about those real-life connections.
And it's not just about how many people you know.
It's about the quality of those relationships.
Having those deep, meaningful connections.
They give you a sense of purpose and support.
Knowing you're not alone.
Which brings us back to purpose.
Ikigai.
Having a reason to get out of bed in the morning.
A passion that lights you up.
Finding that sweet spot where your talents meet something that matters to you.
And it doesn't have to be something huge.
It can be simple, spending time with loved ones, pursuing a hobby, volunteering.
Whatever brings you joy and a sense of fulfillment.
So as we wrap up this deep dive, I'm feeling a mix of awe and empowerment.
All at the amazing things our bodies can do.
And empowerment knowing that we can influence how we age.
We're not just passengers.
We're active participants in shaping our health.
We have the tools and resources
To live longer, healthier, more fulfilling lives.
It's not about finding a magic fountain of youth.
It's about making choices every day that nourishes our minds, bodies, and spirits.
So what can you do today to incorporate these ideas into your life?
How can you strengthen your social connections? Find your Ikigai. Embrace aging with grace and vitality.
It's never too late to start.
And even small changes can make a big difference over time.
The future of longevity is in our hands.
Let's make it a future worth living.
Thanks for joining us on this deep dive. We'll see you next time. Until then, stay curious, stay healthy, and keep diving deep. Thanks for tuning in to Citizen Portal. We hope you feel more informed and ready to engage with the issues shaping our community. Be sure to subscribe so you never miss an update, and visit us at citizenportal.ai for more insights on how local politics are impacting you. Until then, stay engaged, stay informed, and remember, your voice matters.